Ben's a good listener. He's attentive when Geyser Middle School students read to him, and he doesn't interrupt. And when students add drama or expression, he wags his tail. Ben, a huge Newfoundland, is a therapy dog. At Geyser, he has turned reluctant readers into ready readers. We'll meet Ben, the gentle listener.
In the fall, when Ike's family went backing on the island, Solar would stay ashore.
Ben is a 165-pound Newfoundland, brown, and he's been doing this kind of work, therapy work, for just about 4 years. He's 5 years old. He started when he was a year, and he's certified as a pet-assisted therapy dog.
Now, please let us stay up a little while longer. Please, Mother, please. And Bobby, we are the only ones in our whole neighborhood who have to go to bed at 8 o'clock.
Dog comes in as an opportunity for the children to have reading and an opportunity for them to use voice in their reading. The goal is to wake up a sleepy dog with different sounding voices of characters in the stories they've written or stories they've chosen to read. Ben is responsive to a different voice, or a louder or a whispering or a giggle voice. His ears will move or his tail will move, and that gives a lot of joy to the kids. It's immediate reinforcement that they're on the right track with having more than a monotone voice when they read. The other thing is they read in pairs, so when it's not their turn, they get to listen to the story and pet the dog. I think it's an opportunity for them to have unconditional acceptance, a chance for them to have no criticism. And the dog is called a therapy dog for that reason, because it's trained, as is its trainer, of the belief that children need to be accepted and praised and supported. So she has trained her dog to demonstrate those kinds of things, and train the dog to accept the touch of a child who might be lonely, or a child who has no animal of its own to connect to at the end of a school day.
Therapy dogs are dogs that are specially trained to visit in different settings. For example, the READ program that we do here, he visits at the hospital, Southwest Washington, inpatient rehab, he goes to radiation oncology, he goes to cancer survivor support groups, he visits at detention, goes to court with some of the kids, visits with kids on probation, and he pulls a cart and gives kids cart rides at special events.
I had one autistic girl who refused to sit within 10 feet of the dog and would not sit on the floor. It would sit in a chair. And by the end of about 2 months period, she had gotten off her chair and sat on the floor, and gradually each week she would move about a foot closer. So by the end of it, she was sitting right near the dog, and if the dog was looking away, she would reach over and touch its hind quarter and just kind of touch it and take the chance. So for different kids, it meant different things.
The unbelievable thing, if we talk specifically about the Read to the Dog program, has been the kids who have seemed to be withdrawn when we first meet them, and then once they begin to read to Ben, or he starts coming into the classroom, you can't keep the kids quiet. They have loads of questions. They want to touch, they want to lay on him, they want to pet, and all the time that they're doing that, they're communicating in a way that they normally don't do, for a variety of reasons, either because they're not comfortable with the language, or comfortable in terms of the communication process. But it's amazing.
I just know that there's a lot of joy happening, and if we can keep that joy in our education, kids are going to pick up a book because they remember that it was fun.
Not herbal remedies, not acupuncture, but about the healing powers of a lick of the face and a wag of the tail. And if you ask the kids in the pediatrics unit at Southwest Washington Medical Center, a visit from a 165-pound Newfoundland may be the best medicine you can get. It's Tuesday afternoon at Southwest Washington Medical Center. That means it's time for Dr. Ben to make his rounds. Every week, Pat Dowell, who owns this gentle giant, brings him to see the kids in the pediatric unit. Of course, it takes him a while to get upstairs. He has to make several stops along the way.
It's an opportunity to share my love of animals with other people and help bring smiles to people's faces, especially at times when they are experiencing a great deal of stress.
Quite often, Ben brings along his associate, Breeze, and they're both known for having quite a bedside manner.
I think it's just the demeanor, and he goes in so nonchalant, and it's not at a fast pace, and the kids get real excited, and he doesn't care if they're yelling or screaming.
And their healing powers are more than evident.
There was a little kid who was afraid of dogs. He had been attacked by a dog, and by the time Breeze was with us that day, and by the time we had left, after about an hour, the little kid was coming up and at least petting the back end of both of the dogs.
But their visits aren't just for the kids.
The parents love it because they haven't seen smiles on their kids' faces for, a day or so when the kid's been in there, and Ben walks into the room and they get really excited and they want to play, and a lot of the kids will the ones that can get out of bed, they'll get down on the floor and dress him up in the hospital gowns.
The dogs have been coming to the hospital for about a year now, and while this is obviously effective medicine, these kids never seem to mind getting another dose.
Cute. Come up here. Come on.
Yes, he is, and Ben is just a kid himself. Maybe that's why he fits in so well here.
Look who's here. Oh, it's nice. The name for the Newfoundland has always been Gentle Giant, and that's what they are. He weighs 160, but he's still a puppy, so he's still growing. He is just everybody's best friend.
For the majority of patients, both young and older, a visit from a pet therapy pooch is just what the doctor orders.